Let's talk about mold allergy now. How would you describe mold?
Well, mold is, you have where we get exposed to it, mold spores. You can also see debris and growth coming from these mold patches. The hyphae, we call it, the finger-like growth coming from that. Most people react to the spores, but there are actually people allergic to the hyphae as well too.
So when people are allergic to mold, is it an all year round thing, or why does it cause problems in the fall of the year?
You're usually going to see more of a mold problem when there's a lot of moisture. So we tend to have dry winters and dry summers here in East Tennessee, so the mold counts will go down. But we almost always have mold on our counters year round, unless there's snow on the ground. It'll sort of seal it in. But our outdoor counters will almost always have mold spores on them.
When we do mold spore counts, the counters, is the mold spore count usually higher than pollen?
Depends on where you live, but yes, in this area, it's in fact right now, as a matter of fact, we've had a really wet summer and fall and beginning of fall, and the mold counts are very high.
Are there different molds?
Lots of different kinds of molds.
And can a lot of those different molds individually cause allergy problems?
Absolutely, and collectively as well too. And there might be situations, we think, where there's toxic reactions to molds, where there's more of an irritation or maybe even sickness, fever, chills and things from the inhalation of these molds.
Now, we talked about ragweed, now we're talking about mold. Is the allergic reaction different in the nose than it is ragweed pollen? Are they same reaction?
You'll have similar reactions. Most people, and including myself, we have more burning of the nose, and I personally get a metal taste. I've had other patients report that as well too. We think there's more frequent respiratory infections with mold allergy and heavy mold exposure, and maybe more asthma with mold exposure and mold allergy.
Any reason why that might be?
I don't know that if anyone knows for sure. There's certainly, in my opinion, more inflammation with mold inhalation than with pollen.
And certainly mold spores are very small, and it's very easy for them to get in the small. So if they cause asthma and nose problems, you got to deal with both of them?
That's correct.
And you deal with the nose by the same medicines?
That's correct.
So those were the topical cortisone medications. Now, if the mold causes allergy in the lungs, asthma, how do we treat that do we treat that with topical cortisone nose sprays?
We topically inhaled steroid sprays for the lungs. Yes,
What do they do for the lungs that way?
Well, they decrease the inflammation. Very important point, they might decrease remodeling of the lungs. It's not a scarring process, but there's a different type of collagen laid down in moderate to severe asthmatics that makes their lungs twitchier and clamp down harder, and they might even lose lung volumes associated with this remodeling.
So it's very, very, very important that we treat asthma not just with relievers, but also with controllers like cortisone inhalers.
Yes.
Now, what about quick relief? If I'm allergic to mold and I go outside, it's been raining, and I start to cough and wheeze, what can I do to get instant relief?
Well, you would want a quick-acting bronchodilator. Albuterol is the best known one out there. There are others, but they all work the same way. What you don't want to do is use any of the long-acting bronchodilators for quick relief. That can be dangerous.
Now, when do you use them? There are 3 medicines that we use that have long-acting bronchodilator. They'll last 12 hours, along with, in that same inhaler, inhaled cortisone medication. When do you use those?
We use them in all moderate to severe asthmatics, but also patients whose asthma is out of control.
So mold can cause nose and lung problems. How do we know if we're exposed to mold inside the house or outside? How do you know?
Well, it certainly helps if you've been tested and found you're allergic to mold and you're having a reaction to that. But a lot of people can smell mold, the musty odor that comes from it. Certainly if you see mold growing or you smell a heavy musty smell, you might have toxic levels of mold. There are testing kits available, but they're not very accurate, basically. It's best to have a professional look at that.
So you can professionally test the inside of the house?
You can. It's expensive.
Yeah.
Certainly, if you smell it or you see it, you've got a little work ahead of you, and you have to be careful. If there are large amounts of it, you might want a professional to come in and clean it out.
We had allergy testing for specific weeds. Do we have allergy testing for specific molds?
Absolutely.
Does immunizing people to mold, can we help their allergies with mold allergies?
Definitely.